Great. Well, hello, everybody. Welcome. My name is Charlie Moses. I am the Coalition Coordinator for Washington Breathes. And these sessions are for our coalition members and partners who support our vision statement. So thank you for being here. And I'd like to offer a quick land acknowledgement. And we honor that we in Washington State gather on the lands of the Pacific Northwest Coast, the Salish and Plateau tribes. We recognize and honor their invaluable contributions to our state, history, economy, and culture. And we make this acknowledgement as a reminder of the need to work together for a more just and equitable society for all. All righty, so getting into it here, our agenda for today's session, I'm going to ask that first you introduce yourselves to each other in the chat so you can share your name, your organization, your pronouns, and anything else you want us to know. Feel free to get that discussion going. And then, of course, we have great speakers today. Very, very excited for both Jill and Tom and Margaret to all be speaking and in conversation today. So got a lot of good insights to share. And they'll introduce themselves at the start of each of their presentations. And also, again, we want to hear from you. So again, your comments, any questions you have, feel free to put it in the chat. And with that, we will get started with our first speaker, Tom Pryor. So feel free to introduce yourself, Tom.
Great, thanks very much. Tom Pryor here. I am a staff attorney with the Public Health Law Center. Can everybody hear me okay? Great, and you can see my screen all right?
Yes.
Perfect. So I am very pleased to be here today and appreciate the invitation to talk to you about this very important subject, preemption. But before I get into it, I also want to make a land acknowledgement. The Public Health Law Center is located at Mitchell-Hamlin School of Law in St. Paul, Minnesota. And we acknowledge that we are on the indigenous homelands of the Dakota people, also known as the Sioux Nation, and that 4 federally recognized Dakota tribal nations remain in this area. And we appreciate their ongoing stewardship, spiritual connections, and the life waves developed in these homelands upon which the law school sits. A little bit more about the Public Health Law Center. We offer free legal technical assistance to all communities, public health advocates, and other partners. We also publish widely on commercial tobacco control policy, and we offer trainings, webinars, and presentations like this one. We do not, however, offer direct legal representation, nor do we lobby. At PHLC, we prize equity above equality. Equity is about giving people what they need, which includes understanding barriers, circumstances, and conditions. In an equitable society, something like your race, gender, or sexuality should not be predictive of your health or happiness. And at the center, when we talk about public health, we try to take a broad view and to discuss the social and political determinants of health, the network of policies and factors from housing to education to the criminal justice system that impacts people's health and happiness. And finally, as a bit of a disclaimer, when I talk about tobacco products during my presentation today, I'm going to be discussing it in terms of industrial scale commercial tobacco production, not traditional tobacco, which is used religiously, medicinally, and ceremoniously in many different cultures and tribal nations. So with that, here's the agenda for my portion of today's presentation. I'm going to be talking about preemption at a very high level, defining it, discussing some of the hypothetical problems with it, and then in a kind of brass tacks way, how it works at both the federal and state level. So this is a bit of a crash course in preemption as a legal concept, and then subsequent speakers, Margaret and Jill, will talk a little bit more practically about what it looks like in places like Washington and Colorado. So let's begin with what is preemption. Here, the dictionary definition is actually pretty on point. Preemption is a doctrine in law according to which the legislation of a superior government, such as a state government, supersedes that of an inferior government, such as a municipal government, in conflicts of law. So Civics 101, right? In America, we have overlapping levels of government, federal, state, local, and tribal. And sometimes they all pass laws on the same subject. And if those laws come into conflict with each other, we need a way of deciding which one controls. With preemption, we would be saying that the lower level of authority has been preempted by the higher level of government. So federal laws would trump state laws, and state laws would trump local laws. Now, sometimes people make a distinction between ceiling preemption and floor preemption. Ceiling preemption is kind of the archetypal preemption in which federal or state government sets a regulatory ceiling and then prohibits local jurisdictions from regulating above it. So an example would be a state minimum wage law that sets a $15 an hour wage and then prohibits local jurisdictions from setting local minimum wages above that level. Floor preemption is when a state or federal government sets a regulatory floor and permits local jurisdictions to regulate above it. So in the minimum wage example, floor preemption would be setting a statewide minimum wage of $15 an hour, but allowing local governments to set minimum wages that are above that $15 level. Now, when I use the term preemption in my portion of the presentation, at least, I'm almost always going to be referring to ceiling preemption because at PHLC, we typically think of floor preemption as simply regulating and not really as a form of preemption at all, or at least not as a kind of harmful preemption. So the focus in my part of the talk, at least, is on the harms of ceiling preemption. Sometimes it helps me to think visually about things. So, here we have a very simplified graphic of our federal system in the United States in which there are these multiple levels of government with overlapping authority. And sometimes all of them are going to be legislating in the same issue or in the same area. And preemption, again, is the idea that when these laws come into conflict, the law or regulation from the higher level of government prevails. So it's important to note, too, that preemption can be pretty broad in terms of its applicability. So it's not just statutes passed by Congress preempting laws passed by state legislatures. It's also federal regulations. So rules or regulations passed by agencies like the FDA or the EPA preempting state laws or local laws or even lawsuits based on state and local laws. And that's largely true at the state level as well. So a state law or a regulation could preempt a local ordinance or a zoning code or again, a lawsuit based on a local ordinance or zoning code. So let's just give a simple example to make sure that we're all on the same page of what preemption is. So here we have a state that has a statewide smoke-free law that prohibits smoking in most places of business, but explicitly permits it in multi-unit housing. And so the question is, can a city within that state pass a smoke-free multi-unit housing ordinance? And the answer here is probably not, right? And it would depend upon a few things that we'll talk about at the end of my presentation. But this would be kind of a standard example of preemption in which a state law preempts a local ordinance. The city can't prohibit what the state permits. And since the state law explicitly allows smoking in multi-unit housing, there's a good argument that a city can't prohibit it through a local ordinance. So now that we know a little bit about preemption, let's talk about what some of the problems are with preemption. And there's a few basic reasons for why it's problematic. The first is that typically we think that local governments know the local conditions best, and local leaders are most responsive to local community members. But preemption replaces local control with a one-size-fits-all policy enacted by people who are further removed from the communities who are impacted by those laws. Another problem is that it impacts policy innovation in at least two ways. So first, there's this idea in America that we have something called the laboratories of democracy. We have 50 states and thousands of cities, each of which can try different policy solutions for society's most pressing problems. And in fact, most successful and forward-thinking public health laws have their origin in city ordinances. But when you preempt local government from acting in a given space, you're shutting off that engine of policy innovation by limiting the number of policy experiments happening around the nation. But second, preemption locks in policy. Local governments, which are relatively nimble as far as it goes, aren't allowed to adapt to changing circumstances or to incorporate new information, and policy change instead has to evolve at a higher level of government where policy typically develops more slowly. A third basic problem, and perhaps the most insidious, is that preemption harms community involvement and stops movement building before it begins. And one of the big motivations for grassroots campaigning is to change policy. And one of the easiest ways to change policy is to work at the local level, to talk to your city council person or the mayor, who are sometimes your neighbors. And if you can't do that because of preemption, you take some of the wind out of the sails of grassroots campaigns. You force them to travel sometimes hundreds of miles to petition state-level politicians who are relatively insulated from local political pressure. imposing a substantial hurdle to successful community organization. And the thing about preemption is that for all of those reasons, the tobacco industry and other businesses love it. Preempting local laws at the state or federal level is easier than combating them in every city and county one by one. Without preemption, industries spread pretty thin. Industry lobbyists are comparatively weaker on a local level. Local community groups have better access to local leaders and more ability to sway their opinions. But at a state or federal level, it's industry lobbyists who have the advantage. Preemption also creates a set it and forget it policy. You can set a regulatory ceiling, and then it's locked in all across the state or even the nation, so industry can avoid those city-by-city battles. And even better for industry, preemption law chills state and local governments from even pursuing policies, because they can threaten litigation on preemption grounds, which is often enough to scare people away from trying these new policy ideas. Now, with that in mind, let's talk about how preemption works in practice. And we're going to start at the federal level and focus on some very basic concepts. Now, to begin with, the basis of federal preemption is in the United States Constitution, specifically the Supremacy Clause, which states that this Constitution and the laws of the United States shall be the supreme law of the land. Now, as a translation, that basically means that federal laws and regulations can preempt and trump state and local laws, and it's written into the Constitution itself. So how does that work in practice? Now, there's two basic types of preemption at the federal level especially, express and implied. Express preemption is basically what it sounds like. Congress saying explicitly in a statute or a regulation that state and local governments cannot pass policy in a given area. So here's an example coming from the Federal Cigarette Labeling and Advertising Act. And to translate this legalese, it basically says that state and local governments can't require cigarette companies to carry health warning labels because those sorts of rules can only be set at the federal level. And so this makes for a nice and relatively clear command. State and local governments can't operate in this space because it's reserved for the federal government and the FDA. Implied preemption is a bit more complicated. And I'm going to go over it somewhat quickly because the basic thing I want you to take away from this is that there's ambiguity in how this area of law works on a case-by-case basis, and that industry can weaponize that ambiguity and the threat of litigation to combat local policies. So there's two flavors of implied preemption, but in practice, there's a lot of conceptual overlap between them. The first is conflict preemption. For conflict preemption, that occurs when you can't comply with both state and federal laws, called impossibility preemption, or if the state law imposes an obstacle to accomplishing the goals of federal law, called obstacle preemption. So for impossibility preemption, you might have a hypothetical federal law that requires generic drugs to have essentially the same label as brand name drugs, as compared to a state law that requires additional warnings on generic drug labels above and beyond what's required of brand name drugs. Now, there's no explicit preemption here, but a generic drug maker literally cannot comply with both laws at the same time. So under implied conflict preemption, the state law here would be invalid. For obstacle preemption, you can consider a hypothetical federal regulatory regime that seeks to give automakers flexibility in designing safe passive restraints or airbags in new cars, provided they meet with the minimum standard of safety. And you can compare that to a state law that sets a very specific rule for the exact kind of side airbags that automakers must include within their cars. Now, an automaker can literally comply with both the state and the federal regulations, but the state law defeats the purpose of the federal rules, which are designed to provide flexibility to automakers and hence would likely be ruled invalid. The other kind of implied preemption is called field preemption. And this happens when federal regulations are so pervasive that they dominate the field, so to speak. And that suggests to a reviewing court that the federal government has expressed an interest in having complete control over a given area at the expense of state and local governments. So here, a prototypical example might be the laws and regulations around safety rules for nuclear energy, where federal law is so pervasive that it leaves no room for even complementary state lawmaking. Now, often field preemption is used when there's a gap in the regulatory scheme, so that even if there's no explicit or practical conflict between a state and a federal law, the state law is still preempted. The idea here is that when the federal government controls the field, it means they've considered everything. And if a particular regulation is missing, that omission is likely intentional and it can't be filled by a state or local law. So flow charts, things like flow charts can help with this, but it does get complicated pretty quickly. The focus here, though, today is not on all the nuances of these doctrines, so much as the idea that, at least for implied preemption, there's substantial latitude to argue that something is implicitly preempted by federal law. You have a lot of different legal hooks to make that argument to a court. Now, it's not to say that industry can sue claiming a preemption and that they'll always win. In fact, when courts review such challenges, at least at the federal level, there's a presumption against finding preemption. If the state and federal laws can coexist, they should. And courts aren't supposed to engage in a freewheeling analysis. They should be constrained and look only for obvious conflicts. But with that being said, as my kind of 10-minute crash course here hopefully makes obvious, the rules and doctrines are not crystal clear or self-enforcing, and that ambiguity can create legal risk, which is itself often enough to deter policy efforts. With that, let's take a look at state-level preemption. So here we're talking about state laws preempting local policies. And typically that sort of analysis will follow the same sorts of principles at the federal level that we just discussed. And there's 50 different states, so there's going to be variation here, but you'll typically see courts talking about express versus implied preemption. And you'll see similar terminology about conflict or field preemption at the state level preemption court cases. So everything that we just talked about at the federal level more or less will apply to state level preemption as well. One major difference is that when you're talking about the federal government preempting state laws, there's usually no question that state governments possess the authority to pass laws about public health in the first place. And there's an across-the-board presumption that federal laws won't preempt them. But when you talk about state governments preempting local laws, there are different baseline presumptions. And this is because local governments, cities and counties, do not have any inherent authority. They're creatures of state laws, and different states, either under their state constitutions or under statutes or both, will grant them different amounts of power. So one way to generally categorize different states is to think of them as falling into one of two camps: Dillon's rule states versus home rule states. So in a Dillon's rule state, there's a presumption that local governments lack authority to enact policy, and that the state must explicitly grant authority before local governments can act. And typically, there are rules stating that if there's any conflict, the state law will always supersede and preempt local rules and policies. In a home rule state, in contrast, there's a presumption that local governments possess authority to enact policies, and the state must explicitly withdraw authority to prevent local governments from acting or expressly preempt them. Now, Washington is generally considered a home rule state, in that cities and local jurisdictions possess the power to enact policies without needing explicit statutory authorization from the state. However, local policies that conflict with state policies are preempted, and there are some Washington cases that give pretty broad interpretation to what it means for laws to come into conflict with each other. In particular, Washington courts have a somewhat expansive view of implied field preemption, so that a state regulatory regime can impliedly preempt local laws that are on the same subject because, according to the courts, the state has expressed an intent to occupy the field. There are also state laws that specifically preempt local jurisdictions from enacting various tobacco control policies, but Margaret was going to touch on those more in her address. The point being here is that just because you're in a home rule state doesn't mean that local jurisdictions have free rein to legislate on anything and everything, because most states actually exist on more of a continuum. You'll have Dillon's rule states that actually have fairly broad grants of authority from the state legislature, or home rule states that have pretty severe restrictions on their local authority. And Washington is probably going to be something more like that latter category, a home rule state that has a lot of restrictions, at least in the tobacco control area. So why does this all matter? Well, it matters for the basic reason because preemption can tie a local government's hands, but it also matters because, as I've hinted, industry can use the threat of preemption to halt policies before they start. And here's just one example of that from Georgia. Now, Georgia probably sits more or less in the middle of the Dillon's versus home rule continuum, perhaps leaning a little bit more towards Dillon's rule state. And there is a general presumption, for example, that statewide laws of general applicability will preempt local ordinances, and Georgia does indeed have a statewide tobacco retail licensing law. So the question is, can a city in Georgia pass a nicotine-free generation law? Now, a nicotine-free generation law, if you haven't heard of them, is an example of the sort of progressive policy that's being driven by local governments. It effectively bans the sale of tobacco to people who are born after a certain date, more or less phasing in an end game policy so that eventually you'll get to the point where nobody is allowed to buy tobacco products. So this is a clip from an article published by Brian Carr, who is the Deputy Executive Director of the National Association of Tobacco Outlets, authored in the Convenience Store and Petroleum Retail periodical CSP Daily, in which Brian Carr celebrates how the tobacco industry used the threat of suing on preemption grounds to prevent a city in Georgia from passing its own version of a nicotine-free generation law. Now, the Winterville ordinance in question would have banned any tobacco retailer from selling tobacco products to individuals who were born after January 1st, 2000. And NATO argued that the issuance of tobacco sales is controlled by the general state code under the tobacco retail licensing scheme, not local municipalities. So passing an ordinance that would create a complete prohibition on the sale of tobacco products to legal adults in a local jurisdiction would conflict with that statewide TRL scheme and is thus preempted. So as a point of emphasis here, Winterville has a population of about 1,200 people. And despite that, the tobacco lobbyists worked to stop that ordinance purely to prevent bad precedent and likely to stop other jurisdictions from taking up that policy. And again, as a point of emphasis, they never really had to do anything. They didn't file a lawsuit. They just had to threaten that they might file a lawsuit citing preemption concerns, and that was enough to scare the city council away from adopting this policy. So what does all of this mean? Well, most importantly, you should know your state's laws on preemption generally and tobacco preemption specifically. And this is the sort of thing that Margaret's going to talk about. It's also the sort of thing that PHLC can help you with. Do you have the authority to enact the policy in the first place? Is the policy expressly preempted? Is the policy impliedly preempted? If you think there might be a preemption concern, you should think creatively about your options. Maybe you could do something through zoning that you can't do through an ordinance. And you should also weigh your appetite for potential litigation. These are things that certainly an attorney who's working with you can help with, and we're always happy to have those discussions as well. So with that, thank you for your attention. I'll look forward to any questions that we get either now or at the end of the presentation, and I will turn it back over to Charlie and Margaret.
Great, thank you so much, Tom. It's just always so informative, and so appreciate you being here. Margaret, you are up next, and I will let you introduce yourself, get your slides pulled up, and we'll just keep moving right along.
Great, thanks, Tom, and thanks, Charlie. So my name is Margaret Shield. I use she, her pronouns, and I'm the coalition organizer for Washington Breeze. And I've been working on commercial tobacco policies at the local and state levels for about 9 years. And even before that, I've worked on other kinds of Washington state policies where state preemption has also been a challenge. So I'm going to overview what's preempted and what's not in our current Washington statutes on commercial tobacco. So in fact, we unfortunately have more commercial tobacco prevention than most other states. The 5 states shown on this map in the lightest color have the most state laws that preempt local actions. 26 other states have full local authority with no state preemption at all, and those are shown in blue. And then 19 states have less preemption than Washington, shown in shades of green. So as we educate about the problems with preemption, it's also good to understand our policy and political climate. Washington has many state laws that preempt stronger local laws, so it's not just a challenge for those of us working on prevention and cessation. This slide has just 4 examples that are in the public health arena. State law sets a levy limit on property taxes, and that's what funds many key government services. And thus far, organized efforts to overturn that have not succeeded. Cities with soaring rents in Washington cannot adopt local rent control laws to help prevent displacement and homelessness. On gun regulations, our state law fully preempts, which means cities are quite restricted in what they can do to address local gun violence. And then on sugary drinks, Seattle passed an additional tax on sweetened beverages, and it's funding access to healthy food and children's health care and early learning. But Big Soda countered to get a state law that preempts any more of those local taxes on sugary drinks. And some of these preemptive state laws were passed through voters' initiatives, which makes them even harder to overturn. So as we look more closely at preemption in Washington state's laws, I'll overview the impacts, and then we have more legal details on our coalition's website. We have a number of different pages on preemption in particular, and then our tobacco laws and regulations overall. So as Tom explained, local laws generally cannot allow things that state law prohibits, which is good if the state sets a good standard. But our statutes have language in multiple places that explicitly preempts, it's an express preemption, anything that's more protective local actions about regulating tobacco sales. It's ceiling preemption, and it lists specifically what cities and counties cannot do. That language is mostly in RCW 70.155, which first passed in 1998. And then it's also in our more recent Vapor Products Act in RCW 70.345, which passed in 2016. So this preemption has existed for many years. We also have a very strong state smoking in public places law, and that's in RCW 70.160. You may know it as SIP law. It doesn't have any express preemption, but it also doesn't address some public uses. So that does open the door for some local regulations. So the key restriction to be aware of is that local governments in Washington are blocked from regulating the sales and the advertising of all types of commercial tobacco products. That includes no local retailer licensing, which also removes the source of funding for local compliance and prevention. So what are the community impacts of all this? Well, no local flavor bans in Washington, like those that have passed in more than 380 cities and counties nationwide. No local control over how many tobacco retailers can be in a city or where they're located. So nothing beyond standard business zoning laws. And that particular fact is often surprising to prevention advocates in our state who also work on cannabis, because our cannabis laws from the state say that cities and counties can regulate where cannabis stores are located or prohibit them altogether. But tobacco can be sold in mini marts and supermarkets and strip malls where youth go regularly. Also, there are no local age restrictions on purchasing tobacco products. So while it's great that we have a state T21 law that sets that minimum purchase age across the whole state, it also means that local laws cannot set a higher age. So we're blocked from passing those nicotine-free generation laws. It goes on from there. There's a long list of actions that we know help reduce nicotine use and initiation that our cities and counties cannot take. So there is some good news on local authority, and it's all in the area of regulating where smoking or vaping is allowed. So we have that strong state law that prohibits smoking in public places, indoors, and also in places of employment. And local governments can go further than that by prohibiting smoking in outdoor public places. Then our state's Vapor Product Act also gives express authority to local governments, explicit authority, that they can prohibit vaping in indoor public places and in outdoor public places where children congregate. But then that's where there's devils in some details. The language is specific to outdoor places where children congregate. So a local law prohibiting vaping in an outdoor place that's adult only, like an outdoor bar area, that is preempted. State law also protects what's called tastings of e-cigarette products in 21 plus vapor product stores, which means a local law can't just prohibit vaping in all places of employment because vape stores have to get that exemption. In the vapor products law, the language about public use in particular is not clearly written, and some terms, like the term children, is not defined, so there are gray areas. But with that limited local authority, 13 counties have taken action to prohibit vaping in indoor public places, and most of those laws also apply to workplaces. 4 of the 13 regulations prohibit vaping in specific outdoor public places too. So those ordinances were passed by the local boards of health in each county, working with their local public health department and with community support. But unfortunately, progress on adding more counties to the green on this map, it really stalled when the pandemic hit. So in addition, over the years, more than 40 cities and several counties in Washington have banned smoking in parks. 40 is just a ballpark because I have a partial list of those locations, and I'm not sure there's a complete list of those policies at all. So that is just the quick overview. And as Tom said, it's really important to get into the policy details of what the state law preempts or doesn't explicitly preempt when you craft a local ordinance. Our website highlights the actual law language that's important to understand. So look on our policy page where we have all these different sections, and you can check out our preemption and local authority section or our current laws and regulations sections and find that. And then I'm also happy to field your questions about what's allowed and what's not and help you navigate around these little thorny pitfalls that exist. So send me an email and we'll sort it out. And if there's questions, we could take them or we can move on to Jill's talk.
Wonderful. Yeah, maybe we'll wait just a moment, see if any questions come up in the meantime, and otherwise we'll keep it going. It's always just an awkward moment of silence over the Zoomosphere. Okay, easy enough. We will keep it going. Jill, you are up next, and thank you so much. Feel free to introduce yourself.
Charlie, and hello everyone. My name is Jill Bednarek. I am joining you from Colorado. I'm at the Colorado Department of Public Health and Environment. I also want to add my land acknowledgements. The Colorado Department of Public Health and Environment, located here in Denver, occupies space that has belonged to the Ute tribes, the Cheyenne and Arapaho, and we honor their traditions of stewardship of the land and the water in this area. I don't know if any of you recognize the photo I have on I like to throw in a photo of if I get to talk to another state. My son sent me this photo just a couple weeks ago from sunset at Mount Adams, his little tent there in the corner. And then he zoomed down on skis the next morning. So I have a son that's up in your neighborhood, and I get up there as often as I can. I am not following him down Mount Adams on skis. However, I would be clear about that. And I also want to thank Margaret for the invitation to be here, and a shout out to Campaign for Tobacco Free Kids. It was my coordinator here in Colorado who was a key partner in helping to the story I'm about to tell. And also to Tom, the Public Health Law Center has been during several points in my career here, including when we were dealing with preemption, a sort of speed dial. Please let me know, am I on the right track? Are we saying the right things here? Are we making the right messages and interpreting the law correctly? So thank you to both of you. My time here, I want to share a little bit with you about the Colorado story. We, in commercial tobacco control, we were able to, with our partners, educate decision makers about the need to remove preemption clause in Colorado law. And yeah, it is a real summit. Well, it could be the fake summit. I don't know, Haley. This is, my son sent me that, so I was not there. I see the question about the fake summit or the real summit. That's as far as he got in setup camp. So, but back to where I was going here. Margaret, next slide, please. And I'll explain a little bit about what Colorado's we had expressed preemption, which also I think was conflict preemption to illustrate some of what Tom was saying earlier. It appeared in our tax code, interestingly enough, and this dated back probably about 40 years. And there was one part of the tax code that said local jurisdictions could pass cigarette taxes. And it was cigarette because 40 years ago, that was the tobacco product, where the legislation was around that. But a specific part of our tax code that said if locals were going to have a license, any fee on the sale or taxes on cigarettes, then they would lose a share of state sales tax revenue. And that was enough to be, and then threatened communities who were going to overturn that. So we had all the real life examples of the scenarios that Tom was describing about conflict preemption, and then the threat of litigation. So we decided at the state health department, we thought we needed to make change and get Colorado into the 21st century in terms of requiring regulations on the sale of all tobacco products. And I do want to, on the next slide, just to say that we did have a model of the Colorado Clean Indoor Air Law. Our state indoor smoke-free does have floor preemption that has worked actually very well for us. And I copied a part of it. There's local authorities may go stronger than the state law, except for one part of it, they could not go weaker than. And so this part of expressed floor preemption has been useful in Colorado. But back to the removing the regulation on taxing, licensing, and fee for the sale of cigarettes, we decided we needed to really make that a top priority for our program. So at the state health department, we fund most of the local health agencies around the state, and as a group identified this as a huge barrier for local work. And so I think one of the first lessons I want to tell you is get everybody to agree that this is a top priority, and everybody's going to make this their own program's priority to work to repeal it. And how we went around doing that, I'm framing it on the next slide from right here, Margaret, from our role as a state tobacco control program at the state health department, recognizing the dollars we spend cannot be spent on lobbying, and that we ourselves are not lobbyists. And so our role was to ensure that we were educating our grantees, our other state agencies, our leadership, and every time leadership would turn over, make sure that we were making this a key part of our education about commercial tobacco control. And in our connections, we do have some legislators that are assigned to work on our, we have a review committee, a state mandated review committee, and we would make sure that they understood the need for addressing preemption. And then working to build these relationships across the different partners, and using our grant funding to prioritize education materials towards licensing, really, and their justification for that. So we convened on the next slide. We convened a group of bipartisan decision makers and state agency reps and local reps to look through evidence-based strategies and to compare what was happening in Colorado, review Colorado data, and identify existing gaps in Colorado law, and rate the potential strategies for the public health impact and the political feasibility, and have this group generate recommendations. And so there was consensus from this group that this was a top priority. So this was helpful for us to then be able to use in all of our education of the groups that I talked about, and the partnership formation around this is the top priority. This is the core issue that we are all going to prioritize. I will answer your question in a second, Scott. Actually, I'll go ahead. See if I can pull up your full text. I can see it. The local authority at the time referred to just cigarette products. This again, it was a statute in state law that dated to we found something referenced in 1978, and so it was the tobacco. So it was cigarettes is what was the priority then, and that's also, it helps illustrate the problem with preemption. It gets in the state laws, and then it's outdated. You know, the products change, and it does not update automatically when the tobacco product landscape changes. So to answer Scott's question, no, it was just specific to cigarettes. But also that helped give us an opportunity in terms of the education that we did. I have a couple samples of that. We had, this is a handout that we created using our data for our local partners to show that how easy it was for kids to get tobacco products. They weren't being asked age verification. They were not being refused sale because of their age. And kids reporting how easy it was to get. And then the next slide, since the kind of building on Scott's point, since we tried to use the language of the law to our advantage as well. So we did start working with, we said, well, non-cigarette tobacco product exemption or preemption did not exist, even though we understand from an evidence base, we needed to be licensing all tobacco products. We thought for a window of time, let's go ahead and promote non-cigarette tobacco licensing at the local level so that we could obviously skirt around the preemption. And even with that, like we did quite a bit of data collection, we learned that more than 80% of the retailers that were selling non-cigarette tobacco products were also selling cigarettes. So we were, and many of the retailers thought it applied to both products. We were able, then we tracked the implementation of these policies. We got about 4 communities that passed these non-cigarette retail licensing. We were able to use to show that it increased compliance when there was local inspections happening, because the state inspections, many of these retailers, they knew that they may go a couple years without getting a state inspection. And when they did get an inspection, they would call and let their neighbors know, oh, I think they're here. We think it's them. And, you know, it really, the whole field was towards their advantage. And then when we had local licensing and local inspections happening, we saw an increase in compliance. So we had data that we were able to share. Another key point I want to say is never waste a good crisis. We had in 2017, Colorado led the nation, according to the Youth Risk Behavior Survey, with the highest rate of current vaping among high school students in the states that participated in the YRBS. And that we have been talking to our decision makers. We've got a physician from Children's Hospital here. We've got, it was then our governor, Hickenlooper, who's now Senator Hickenlooper from Colorado, in this picture here, but it caught the attention of our decision makers to have such a dubious distinction. And they were, okay, what can we do? What can we, how can we make change now? And so we did a lot of education about this problem and using the crisis of being the state with the highest youth vaping rate in the nation, and helped get them on board with addressing preemption and rolling that back. So then within 6 months of when that declaration was signed and that big media event, then we were we had a bill that passed that removed, that struck out the preemption on licensing and requiring a fee for the sale of cigarettes. Taxation, there was an argument that if a local jurisdiction passes taxes on cigarettes, they ought not to be able to get a share back of this other sales tax revenue. So that part did not remove, but they are not prevented from passing their own tax. And so the next map of Colorado, we have this, we don't have the beautiful shape that your state has. We have just a square shape. And so shortly after, so the darker dots, I can't see my screen very well. So I have a comparison of the communities that had licensing, that had done these non-cigarette retail licensing right before the preemption removal, and then comparing that with what happened just immediately after the removal of preemption. And we went from having a handful, the red dots are the before preemption removal. So they were really kind of our out there laboratory, willing to take a chance on these non-cigarette tobacco retail licensing. And then within months, all of these other, the dark colored dots passed policies right after that, including countywide initiatives or what those other on the map there. And since then, well, we also had the same challenge with COVID slowing local policy down considerably that Margaret mentioned that you all are dealing with your smoke-free. But since the preemption was removed, we had a significant number increase in local licensing and got rid of the non-cigarette part of those ordinances and updated those, and meeting our recommended having an annual license fee, a fee that adequately covers administrations, a minimum number of checks, and minimal and meaningful penalties to ensure that it was more than just a slap on a wrist that the tobacco industry was going for. And then, so since then, we have now a statewide licensing that has for preemption that is modeled on the best practices of what our locals were promoting. And we are now up to 40 local licensing initiatives. And the communities are going further and adding equitable enforcement provisions in the language in their laws. So following the guidance of national organizations that recommend that we not have police be the enforcement entities, and instead we're going in with clipboards and following the equitable enforcement provisions recommended by Campaign for Tobacco-Free Kids, Center for Black Health and Equity, and Preventing Tobacco Addiction Foundation, among others. We are removing minors in possession ordinances. That's another thing the industry really prefers to go blame it on the kids, blame it on parents, and have no restrictions on retailers. And we are reversing those. And I think we're up to even higher there. I think we've been able to roll back about 50 minors in possession ordinances locally because of getting rid of that really fairly small preemption that was the threat of that preemption loomed larger than actually the language in the law. We now have 6 communities that have banned sale of any flavored tobacco or nicotine product. And our 2 newest policies that I'm really proud of are 2 new communities that have capped the number of retailers, and no additional retailers will ever be able to have a license to sell tobacco in those communities. So the takeaway from this is, with preemption, we were hamstrung and always behind, and we were always following the rules set by the industry, even in areas beyond what was preempted in the law. Getting rid of that preemption has really moved us ahead. It was slow going. It took a long time. It was really about 10 years from the time we first got the idea till we were able to bring it all to fruition. But since then, the types of policies, I would say we have more than 10 years worth of progress in what has happened since then. It really did speed up But I will also give you a warning that, poking the bear doesn't, they've been looking for ways to accuse us of misspending funds. They've made other inroads in terms of helping to craft our nicotine tax. They were able to make partnerships with the decision makers there, and we passed a nicotine it was nicotine and other tobacco products and cigarette the same day that Oregon passed your most recent tax, and we negotiated a deal with the industry that, in my view, really undercut the power of what doesn't follow what like the Surgeon General's recommendations on tobacco taxes. So there is a warning with poking the bear. And let's see. So I think some lessons I would say is really do rely on those relationships, build those relationships. There are entities that can lobby. There are those of us that can't. We really keep that separate. We make sure that we are sharing lessons learned and building, being consistent in our setting priorities, and continue to raise awareness about how preemption can impact. It helped our decision makers understand that it was more than just tobacco control that this could spill over into. Your example, Margaret, of the soda tax from Seattle and then the rest of the state, it does tie the hands of public health in other areas, and never give up.
Well, Jill, thank you so much. Yeah, I mean, it's always just so valuable to see what policies are going through in other places that we can just, maybe piggyback off of, if it works. But so for the next couple minutes, we have a few questions that we just want to cover, kind of jump into a bit of a discussion, and then we'll let you all get on with your days. There's a question that has to do right with your presentation, Jill, and so I want to get to that one first, and then Margaret, I know you had one come in as well. But a question from Scott Waller here in the chat. In Colorado, does the local tax authority extend to both tobacco products and tobacco delivery devices?
No, at the time that the preemption language, it was just cigarette. Now it's broader than that. Now it has been updated since then.
Great, thank you.
So I got a question through private message from someone who had to leave the webinar, but it was about Washington law, and the question was, is it legal for schools that are not in the counties that passed, no vaping ordinances? Is it legal for schools to put up tobacco-free, vape-free signs on their campuses? And assuming yes, but she says she hasn't seen them. So yes, and so I wasn't able to cover everything. Our state laws prohibit smoking and vaping on school grounds and inside schools. The wording is a little bit different for smoking as it is for vaping, but so that is prohibited. For whatever reasons, the State Vapor Products Act does not require signage in schools and doesn't offer signage. I mean, signs are available, but I've also heard that many schools don't have those signs saying it's, smoke-free, vape-free, perhaps drug-free campus. That's something we've talked about in Washington Breeze, and later this summer, I hope to be letting you know we have a limited number of school signs that we can make available to some folks. So, but they are hard to come by, the good aluminum signs that you can put on the outside of a school. So, you can have a state law that sets a good standard, but without the local implementation, and the funding to do that, it loses a lot of its teeth. Yeah.
Okay, well, I want to bring Amanda. I'm going to get to your question in the chat, but I want to keep it on the Washington State focus for a second. Margaret, do you know, is anyone discussing a statewide tobacco-free generation law in the state?
So I've not been part of those discussions, and these endgame types policies are kind of new. It's Massachusetts we're watching where they're moving and a number of cities adopting them. And so I'll leave that question to others who might, I don't know if any legislators are thinking that way. Whenever I get a chance, I make sure legislators that I interact with know that Washington is really falling behind in its in its innovative policies to try to reduce tobacco and nicotine use, and that there are other strategies that we could try. But right now, most of the strategies have to occur at the state level unless we change this preemption.
Okay, and Amanda, I'm gonna cover your question and then we'll popcorn back to the strengthening tobacco laws in schools question. But for Jill, Amanda was asking what resources were given to those community members that struggled with commercial tobacco dependency that are now unable to purchase the commercial tobacco products.
We've heard few, if any, of those kind of questions. I'm trying to think of any that I have heard about. But what I will say that we work to be proactive in terms of educating about resources through the Quit line, including free NRT. We've done some pilots with some other approved cessation medications through our Quit line, and do more promotion of those quit services, since this is a time that can be, we know that I think our most recent data, it's nearly 70% of adults who are currently smoking tell us they've made a quit attempt in the last year. More are wanting to quit. So we really make sure that anytime a policy is being passed, that we are doing a lot of education about cessation resources at the same time.
Excellent, excellent. And we'll end with Tom. Tom, you have a question in the chat here. In states where preemption does not prevent local authorities from enacting flavor bans, what have been some of the legal challenges presented by the industry? How have those been resolved?
Yeah, it's a great question. And so I did put in the chat, we have a recent resource on this for legal challenges specific to Minnesota regulations. We also have other resources on legal challenges to flavor bans in places like the LA County. Our litigation tracker will talk about some of those cases. The standard argument from industry is that it's preempted from the Tobacco Control Act. They argue that a flavor ban is effectively a product standard, and thus it's the sort of thing the FDA should implement and not a state or local jurisdiction. Those legal challenges have thus far been unanimously unsuccessful. Most courts understand the distinction between a sales ban and a product standard, and they've upheld that distinction. But not a lot of time to get into the nitty-gritty of those details, but we do have a lot of resources on our webpage that walk you through those arguments and how they have not been successful.
Great, thank you. And Tammy, I apologize that we are not elaborating on strengthening tobacco laws in schools. Washington Breeds also does have a bit of information covering that on our webpage as well. And I will wrap it up for us here. Just thank you everybody so much for taking the time today. Thank you to Tom and Jill and Margaret for presenting and putting together these great presentations. Quick information, Washington Breeds, we have an event coming down the pike on August 15th at noon called Reels and Shorts and Stories. Oh my, it's a social media training. If you're available, keep your eye out for the event invite and link. And again, thank you all so much, and I hope you enjoy the rest of your afternoon.